Vasectomy, when done correctly, can have a profoundly positive impact on a man's life. I've personally done over 2,000 vasectomies, and in fact it's not just the man's life that it can have a positive impact on, but the couple. It takes about 8 to 10 minutes for me to do a vasectomy, typically on a male with normal anatomy. I could do it quicker, but there's no hurry here, and usually that's quite satisfactory. I'll typically enter into a conversation with a male about something that's of interest to him. Baseball, football, whatever it is, and before the man knows it, the procedure's done. Especially with the no scalpel technique, it's a procedure that moves quickly, that is minimally invasive, and that's why, in my experience, the patients have much less side effects with the no scalpel technique. They heal up quicker, they're back to work sooner, and getting on with their lives more quickly. Vasectomies have an extremely low failure rate because of the nature of the procedure. However, it's important to know that the patient must be tested following a vasectomy because it is not a perfect procedure. While it's almost perfect, it's not quite perfect. In fact, I like to see 2 semen analyses in a row that are acceptable before I say the procedure was a success and you can discontinue other methods of contraception. About 5% of males who have a vasectomy ultimately wish to have children at some future time. Oftentimes, in my experience, their mate just simply changed their mind. And when I'm talking to a couple, if that female is even in her mid-30s, I still think she can change her mind, and that no matter how determined she is that she's not going to. I've seen it happen so many times, but I think it's wise to consider freezing. What we do at the Male Fertility Specialists is have an extremely low price for freezing sperm in a man who's about to have a vasectomy. So we've basically made it a no-brainer. It is something that can be done over a few day period of time. It can actually even be done over a few weeks following a vasectomy in many instances. So even if the vasectomy has already occurred the day before you find us. Also, many urologists are trained that if a young man is of a certain age, that they refuse to do a vasectomy. Well, I've completely changed my opinion on that. I will do vasectomies on men even in their young 20s. If they've frozen a fair amount of specimens, it is possible to have that vasectomy but have your fertility options preserved.